When you come to South Florida, a lot of people just think, hey, I'm just here to have fun. I'm here to have a good time. I'm gonna go to a club. I'm gonna go to the beach. It's South Florida. You're not really thinking about HIV.
Keep it up.
AIDS Law 2023.
It's all about one love.
Hey, what's up? It's your boy Flo Rida, and we're live here today at Florida AIDS Walk. I'm bringing that good Flo Rida energy, something positive, something, that brings joy, peace, and love. Very important to raise awareness for HIV and AIDS. I mean, this is something to purpose. This is something that, definitely has taken a toll on a lot of, beautiful souls, and it's very touching.
Now, what is our goal? End HIV. Today, we're at Triple T Thursdays, which is test, treat, and teach. You got it, you got it. For a long time, Miami-Dade County has had the highest rates of new HIV infections in the nation. Here, HIV persists as one of the top 10 leading causes of death among Black people. And that enrages me, it infuriates me, it keeps me up at night, it wakes me up in the morning. Who's parked out front? The mobile PrEP unit. Have all of the medical advances. What we don't have is a proven and standardized system to get the information and the therapeutic advances to the populations that need them the most in a way that's trustworthy.
Hey, look, I feel all right. I'm gonna take my medication and I'm gonna lay down, pray at my dog, and watch me some TV, and I'm good.
We now have all of the medications necessary to treat HIV, to prevent HIV before engaging in unprotected sex or IV drug use, and to prevent HIV 3 days after you've been at risk.
Let's do HIV 600.
HIV is serious stuff. Sexual wellness is serious stuff. Death is serious. So we try to educate people in a way that enlightens and increases understanding, but also empowers. Like, look at all these resources. Look what we can do about it. This is the second most common way to spread HIV. You said it, Team 3, what is it?
Needle sharing.
Needle sharing, yes!
The basics of needle exchange is that we help people prevent infectious diseases by providing them clean needles. I am the Behavioral Health Director of ID Exchange, Florida's first needle exchange program. The purpose of the needle exchange program is to prevent transmission of diseases amongst people who inject drugs. In Miami-Dade County, we are #1 in new HIV transmissions in the nation. This is the bones of our exchange program. These are all the items we give individuals so that they can inject safely: sterile water, saline water, cookers, alcohol swabs, and cottons so that they can filter what they inject, as well as tourniquets. Every individual who comes here is given Narcan, and Narcan is used to reverse overdoses. One of the beautiful parts of IDEA is that we have high multicultural competence, both with the culture of people who use substances, and within the culture of treating those living with HIV. As a Cuban American, I'm doing everything I can to engage the Latino population. We're doing everything I can to engage the Black community. We're doing everything we can to engage whoever needs to be engaged.
Telling someone that they're HIV positive, it is challenging. We want to make sure that we let people know that just because they're HIV positive doesn't mean that you can't live your life.
Here, this NC test is going to be a finger prick. You're going to get your result back immediately.
Here at AHF, we do offer a HIV test on the truck. Our main mission here is to, end the HIV epidemic.
I'm going to apply a little pressure on it, and I'm going to give you a little finger prick, okay?
There's a stigma with HIV. So a lot of people, they don't want to get tested, but when they see the truck, they say, you know what, this seems really private, really safe. And we walk into the truck, close the door, we take the test, and then, they get the result and they feel at peace.
I've been tested for HIV as many times as I'm next to that truck. You know what I mean? So sometimes I'll do it twice in a day. If the earlier audience didn't catch me getting tested, I'll do it again for the later audience. I remember seeing Biden take the shot for COVID and thought to myself, yeah, it should be like that. I think more community leaders and public figures should be tested publicly.
I'm here today for the AIDS Walk in honor of my brother, Alan Butcher, spending the day celebrating life and all that he lived for in his life. Where we are today in 2023 compared to where my brother unfortunately was in 2001 has come leaps and bounds.
We came out here today to support LGBTQ and Sunshine Cathedral.
We do know several people who have been affected with HIV/AIDS, and unfortunately they were not able to be out here today. So we are out here for them, with them. We walk with them.
Let's hear a big round of applause for all of us who showed up today to make this happen. We've broken all records in fundraising this year, and we're on track to raise over $3 million.
My name is Mauro Schiller. I'm a PrEP counselor and HIV specialist for Latino Salud.
Latino Salud!
I have been HIV positive for over 20 years. Very well under treatment. I always say to everyone, if you are sex active, you need to get tested at least every 4 to 6 months. Even if you don't feel that you're being at risk, you never know.
There is absolutely no reason why anybody should die of HIV or AIDS-related illnesses in 2023.